I'm a state senator and I'm leading the fight against childhood obesity in my community. We've got a problem, a very big problem. We've got 1 in 3 kids who are obese, 33% of our population in Ohio that is obese or grossly obese, and that is a precursor to diabetes, heart disease, and other types of diseases.
We can never become complacent on this issue, or we will never be able to put the leading causes of death that are due to obesity in the history books.
Type 2 diabetes is one of the most critical factors in terms of our public health issues moving forward, and it all stems from the obesity epidemic.
The data's there. We know what the problem is. We know how significant the obesity problem is.
One of the schools that I visited, the principal said we have 3 kids in each class that is diabetic.
We've got a lot at stake.
It's critical. We need elected officials, community leaders to recognize this is real.
We absolutely know that there are some of our neighbors that are hit harder than others, where a local fast food is their only choice of food in that neighborhood.
Food deserts, to me, means the inability of someone to have access to healthy fruits and vegetables.
We have lots of neighborhood convenience stores, but we need to help those business owners so that their business plan supports good business and good health.
I want everyone to have access to real, healthy, good food every single day, no matter where they live. We are helping schools to set standards for the kinds of foods that they'll sell outside of school lunch to make sure that they're healthy choices for kids.
We've implemented education tools or teaching tools into our schools, and my hope is that the kids will come home and change the parents.
Really, in our community, we have barriers to participation in physical activity.
They don't feel safe, and in some cases they aren't safe to turn their children out to play in the street, that game of kickball or baseball or softball.
The Y is providing access with subsidized memberships through our Membership for All program to start that process of environmental change.
The WeTHRIVE program has emphasized walking to school or having kids ride their bikes to school.
We want that child to be able to walk down their sidewalk that connects to the community park, gates that we've opened through shared use agreements. Environmental change is so important to the community.
Parks often pay for themselves. Well-maintained, good parks will generate higher property values in the areas surrounding the parks. It's sort of a win-win situation.
This is going to take all of us, from the decision a parent makes at the grocery store to what our kids are eating on the lunch line to what's being served in the neighborhood.
Saying, hey, listen, let's look at this from a community standpoint holistically, and let's make changes throughout a particular community.
We're working from the grassroots, so every neighbor, every pastor, every parent, every principal, every physician has a role to play.
It's really about bringing the community together to really affect environmental change for our community, focused around healthy lifestyles. We need to have the healthy choice be the easy choice.
We know what works. We just need to have the courage to get it done.